This next EKG, you've got a little bit of a gap here. I think this is what we're trying to point out. You see a P wave that sort of landed on the T of this prior beat, and you did not put out a QRS. So this is some kind of an exit block or a non-conducted P wave because it landed in the T. The ventricle was still repolarizing and was not ready to fire again. But overall, the rest of this EKG, probably fine. There's a little bit of LVH if you look at the size or amplitude of the QRS complexes, but otherwise pretty normal overall. This next EKG is quite tachycardic in the range of maybe 160 or between 100 and 150, 120 maybe. But what you notice on this is that sawtooth pattern, which is what we're trying to point out here. This is what atrial flutter looks like, generally speaking. However, if you look at lead 1, you don't see that sawtooth pattern as much. So this could be artifact where the patient just has a tremor of some sort that makes it look like that. So make sure you look at the patient, examine them. If you notice also V2 doesn't have it, V1 really doesn't have it. V1 looks pretty sinus. If you look at V1, there's almost like a second P wave in there. So this could be a 2-to-1 atrial flutter, and it's just not in V1. It's just not showing the full sawtooth pattern. But this is definitely highly suspicious for atrial flutter or some kind of 2-to-1 AV block. They are quite tachycardic.